Good evening, everyone. I am Dr. Kalyan, MV, working as Interventional Cardiologist in Kamineni Hospitals, Vijayawada. Today, I am sitting in front of you to speak my perspective of Congenital Heart Disease Awareness Week. So, what is Congenital Heart Disease Awareness Week? It is usually celebrated in the month of February, from 7th to 14th of in the month of February every year. So the other thing is, what is the need to celebrate Congenital Heart Disease Awareness Week? The essence of celebrating the Congenital Heart Disease Awareness Week is nearly 1% of every live birth born are usually affected by congenital heart disease. 1% means it usually 1 in every 100 childbirths there is a person with congenital heart disease. So what is the importance of occurrences? As one person is affected in 100 live births, the importance is the congenital heart disease can lead to mortality as well as morbidity of the child. It means as the child with congenital heart disease grows, it may usually affect his life, his mortality, that is, his life expectancy can decrease, or he is usually affected by the disease throughout his life. So because of this importance, we need to know why the importance of congenital heart disease, how it is affecting different families, and what is the perspective of the families, and what is the role of the physicians and scientists, researchers, and the government in knowing the essence of the congenital heart disease. So coming to the history of congenital heart disease, it usually started in the year early 19th century, when T. Peacock was the first person who wrote the nomogram regarding congenital heart disease. It was later followed by T. Towson. She was the person who took the congenital heart disease to the next level by doing some surgeries for congenital heart disease. So after knowing the history of congenital heart disease, so we come to what are the causes of congenital heart disease. The congenital heart disease causes could be many things. Usually the most important is it is in the form of environmental, genetic, or if the mother is suffering from any infections in the form of rubella infections or metabolic disorders like hyperglycemia, or if the mother is if she unknowingly or knowingly takes some toxins which in the form of cigarette smoking or alcohol, it can usually lead to congenital heart disease. So these are the causes which lead to congenital heart disease. So what are the different types of congenital heart disease? Congenital heart disease are usually classified into 3 types. One is depending whether the heart disease is simple or complex. Simple means in the sense only a single lesion is present in the heart disease. Single lesion means it is usually in the form of usually septal defects or any stenotic lesions. Complex means here 2 or 3 lesions are associated in the single child, which leads to complexity of the disease. The other classification is whether the congenital heart disease is cyanotic or acyanotic. Cyanotic in the sense the saturation of the baby usually falls below 90%. In the acyanotic heart disease, the saturations remains above 90%, but still the child has congenital heart disease. So other things are whether stenotic lesions are regurgitant. Other classification is whether the congenital heart disease is stenotic or regurgitant. Stenotic in the sense can be in the form of aortic valve stenosis or mitral valve stenosis or tricuspid valve stenosis. Regurgitant lesions means in the form of tricuspid atresia, any bicuspid valve lesions leading to regurgitation. All these come under regurgitation lesions. Or in the form of abnormal communications, where the great vessels arising from the heart usually change in their positions, leading to the abnormal communications. So these are the different types of congenital heart disease. So what is a congenital heart disease? Congenital heart disease is heart along with the vessels originating from the heart usually they don't develop now in the normal positions. They change. They either develop abnormally or the communications in the heart are changed during the developmental of the heart. This usually occurs when the child is in the mother's womb. That is during the first trimester to the third trimester. Anytime it can occur. Usually around the end of the first trimester. So after knowing the different types of congenital heart disease, so we come to the management of congenital heart disease. The management of congenital heart disease may be either in the form of definitive surgical procedures or palliative procedures. Definitive surgical procedures is where the defect is usually corrected, which leads to decrease in the morbidity and mortality of the patient. Palliative surgeries are in which surgery is done only to prolong the life of the child, not to not to cause the death of the child. It is only done to prolong the life of the child, but it is not the full treatment. So both the types of surgeries are there. Depending on the type of congenital heart disease, the complexity of the disease, either it may be definitive surgery or in the form of palliative surgery. So what is the importance to know is all the congenital heart disease, they can be detected in the mother's womb itself. So how the diseases can be detected is we have a new subject arising that is known as fetal medicine. By using the fetal medicine, the doctor can doing ultrasonogram, he can decide what are the defects present in the child when the child is in the mother's womb itself. So by undergoing an intranatal scan, we can at least for some extent we can know the disease present in the child in the mother's womb itself. If it is more complex diseases, later the obstetrician and fetal medicine they can decide whether to along with the addition of the parents, they can decide whether to continue the baby or not. So most of the thing what is happening in our country is most of the parents, they do not know that that the congenital heart disease can occur in any of the child. Unknowingly, after when the child is born, when the pediatricians tells them that the child is affected by congenital heart disease, then they land into depression or and they land into anxiety. So if the parents know beginning of the birth that any person can have congenital heart disease, then they will be more aware of the congenital heart disease, and they can know what are the steps to be taken to decrease the incidence of congenital heart disease, or how to prolong, or what are the surgeries to be taken if the child is born with congenital heart disease. Then we come, so what we should know is congenital heart disease can occur in any child and it has a treatment. Only thing is we should be more aware of the congenital heart disease. What are the different types of congenital heart disease? What are the different treatments options available for congenital heart disease? So coming to prevention of congenital heart disease, the main aspect of prevention of congenital heart disease is the mother should be more aware that during the childbirth they should take sufficient quantity of nutrition along with supplements in the form of folic acid. So by taking sufficient folic acid, most of the congenital heart disease can be prevented. The other important thing is maintenance of normoglycemia, that is the sugar levels should be in well maintained during the pregnancy, because hyperglycemia can lead to many number of congenital heart diseases. And they should also be aware that without the proper consultation of the doctor, they should not take any medications from the outside the over-the-counter medications. And the fourth is regular antenatal checkup, along with, if any possibility is there, they should have a fetal ultrasonogram during the intranatal period. So these are the things which help in knowing the incidence of whether child is going to have congenital heart disease, and if the child is born with congenital heart disease, what are the steps to be taken, what are the surgeries to, and what is the need, and what is the time to go to a cardiologist, like pediatric cardiologist, to take the definitive treatment measures. So at the end, what I would like to say is about the congenital heart disease awareness week is the child who is born with congenital heart disease, we should celebrate that he is not only the single child. There are many people who are suffering with congenital heart disease. He is not alone in this fight. There are many people along with him to fight this disease. The other important aspect is that parents of the child, we should support from the government, from the medical fraternity, from the scientists. We should support the families of the child who are born with congenital heart disease, and we should give moral support as well as financial support from the government. The third, I think this week should be celebrated. Even the parents should be thankful for the doctors or the scientists who are helping them in the fight with the disease. The fourth should be the main role of the government or the public. They should have the regular awareness, it should not only be celebrated once in a week, like it should be celebrated regularly through mass media communication, that what is the essence of congenital heart disease, how can we prevent it, and what are the steps to be taken when a child is born with congenital heart disease. With this, I think that I have a little bit opened the door for a little bit of awareness created so that you can take sufficient steps for the prevention of congenital heart disease. Thank you.